I'm John Feller. I'm the medical director of Desert Medical Imaging. I'm a diagnostic radiologist. When I first began as a radiologist 30 years ago, my interaction with pathology was limited to the occasional primary bone tumor where the pathologist would come down and say, hey, we can't render a diagnosis until we know what the radiologist's opinion is on the conventional radiographs, and that was about it. But in the subsequent 30 years, it's clear that in the interest of improving patient care, that interaction between radiology and pathology has become much more of a team sport. And it's at multiple levels. A few years ago, initially, that was with the pathologist starting to come down to the imaging suite for fine needle aspiration biopsies and core biopsies to help determine if the specimen was adequate enough so that we could stop taking biopsy passes and improve patient care in that way. Following that, several years later, when we started to develop a MR-guided prostate biopsy program, the pathologist was willing to come to the radiology MRI suite and help to train the radiologist to make sure that obtaining and preparing the biopsy specimens was appropriate. Taking it a step further, that collaboration then went on to develop an integrated report where there was input into the report from both radiology and pathology, developing really a communication tool that is fantastic not just for the referring physician, but also for the patient, with nice color images, graphics that explain the content of the pathology report, images of the imaging devices that were used in radiology to obtain those biopsies. Taking it even a step further, that team sport concept now includes collaborations directly in patient care, where the pathology team that we work with helped to develop a program where the pathologist could do image-guided fine needle aspirations, for example, for thyroid pathology, for head and neck tumors, for some lymph nodes in the neck. And we helped to train the pathologist to do some of these procedures under ultrasound guidance. We provided some of the infrastructure as radiology team that does that. And this helped to really integrate the services that the pathologist was providing into our image-guided biopsy program. Another benefit on the radiology side of things was that obviously pathologists in their community have a very large network of physicians that they work with, and so this was kind of a dragnet that helped to bring additional referring doctors into the radiology practice. So it's one of these situations where really, as I look back over 30 years, it's a win-win-win. It's been a win for radiology in terms of improving our ability to provide image-guided biopsies. It's been a win for pathology because there are additional services such as doing ultrasound-guided fine needle aspirations instead of just palpation-guided aspirations. And then ultimately, the real beneficiary is the patient. Improved quality of the biopsies and FNAs that are done, and improved communication tools in the forms of these almost multimedia reports that we've helped to develop with the pathologists.